Dr. Stephen Randall is here from Gundersen Health System. He is a pediatrician. You're here to talk about enterovirus. It's been back in the news lately. There was a preschooler in New Jersey who passed away quickly from it. Got some parents worried, so we wanted to bring you in, answer some questions about it. Yeah. What is, quickly, enterovirus?
So enterovirus is a virus that's very common, typically circulates in the summer and in the fall, and there's multiple strains of the enterovirus. And what we've been seeing this year is one particular strain, D68, has been circulating at higher levels than normal. And what we've also seen is that some kids are getting unusually severe symptoms with this and requiring hospitalization.
What are some of those symptoms? What can parents look for?
So with an enterovirus, it's like a cold virus. So kids will get, and adults can get sick from these with runny nose, sore throat, cough, fevers, headaches, other things like that. What we've been seeing with this virus is that kids who have asthma, it seems to trigger their asthma more than usual. And even some kids without asthma will end up with wheezing. And again, a small percentage of kids get sick very quickly and end up in the hospital.
I was going to say, these seem like such common symptoms. You know, every kid gets them when they get sick. What should parents look for when it starts to become dangerous?
Absolutely. So the things to look for would be if your child is having difficulty breathing, symptoms are getting worse than you'd expect. For kids with asthma, what we'd want to see is if the rescue medications that you usually use when your child is sick are just not working or things are getting worse, those would be the times to come in and have your doctor take another look.
How is this treated?
So there's no antibiotics that work for a virus, so it's really a lot of supportive care kinds of things. So at home, it's all the typical things you do with a cold to stay comfortable, and in the hospital, it's really providing any extra support that kids would need with their breathing. And again, it's a very small number of kids that end up needing to be in an ICU or have a lot done for them.
All right, and not just enterovirus, but this is a good time of year to talk about flu shots as well.
Yeah, absolutely. So enterovirus is not the same as influenza, but influenza is same kind of symptoms, a viral upper respiratory infection, and for that one we do have an immunization. So now's getting to be the time of year where people should be looking to get their influenza vaccine taken care of. All people ages 6 months and older are recommended to have a flu shot.
All right, Doc, thanks so much for coming in and giving us the information.
Absolutely. Thanks for having me.
We'll be right back.